A more recent term that we hear in ABA lately is trauma informed care or trauma assumed care. And what does trauma assumed care look like? And how can we implement a trauma assumed care approach with our learners? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts who create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about trauma informed care. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So when I think of trauma, I think almost of the invisible things that we can see. If somebody breaks a bone and their bone heals and they may look fine, they're able to walk and you can't really see anything in that spot, but that spot is always going to be a little bit more sensitive, or that bone may be more susceptible to break much easier next time. And so we need to be careful about that, and we need to be sensitive, even if it's something that we can't visibly see or isn't something that is so obvious. So similarly with a trauma, when we talk about trauma informed ABA or trauma informed care, we're not only talking about the big things like a broken bone or a student having experienced something that is almost like that big T trauma. It is really anything that might happen in their lives that might make some area a little bit more sensitive.
Gregory Hanley talks a lot about trauma informed care, and he says it's not enough to call it trauma informed. We actually have to go in assuming some type of trauma. And like Shira said, it doesn't have to be a big trauma. It can be something smaller or something that may even be perceived as trauma to them. But we should really assume that everyone has some kind of trauma, whether it is real or perceived. Because you know what, even if it is perceived, it's real to them. How does this trauma assumed care then relate to ABA, and how can we relate that to our clients?
I think it really comes back to if we assume that people come to us with some sort of experience that may have been challenging or negative, even more so, we need to come to them with a compassionate and a healing and holistic approach. So we want our students' experiences with us to be positive. So if we're going to assume that they may have had some sort of trauma or something might be hard for them, then we're going to start off with relationship building, with compassion, and not start off with, trying to making them upset or doing something that's really hard for them.
So, trauma can be defined as experiences that cause intense physical and psychological stress reactions. But trauma can also be defined as, experiences that, cause just a little bit of stress. And, some stress is good, but, we're talking about, that bad stress of like, I don't like this at all. And the way trauma relates, like Shira said, we need to build relationships, and we need to make sure those relationships are intact before we target anything else. But, as behavior analysts, a lot of time we're looking at behavior reduction programs, and we're looking at analyzing behavior so that we can reduce challenging behavior. And we really need to look at trauma as one of the functions of behavior. We look so often at, okay, well, is it escape? Is it attention? Is it this? Is it that? But we really need to be asking ourselves, could this be because of trauma? Trauma can be a function of behavior, and or it can be a setting event. Setting events, things like, the student didn't get enough sleep last night, or the student, isn't eating properly, they're hungry, but it could be trauma. So looking at trauma in terms of, assessing behavior as well.
And not just with the students that we work with, but having a trauma assumed lens in working with the parents and working with teachers. Very often with parents, we try to support them and we try to train them on certain principles. And it might be frustrating as to why things aren't working or why they're not as open to learning as we may want them to be. And we have to remember that these parents are really under a lot of trauma. And it might be challenging for them. And the same thing with teachers. Sometimes it might be frustrating where they may not be managing behavior properly. But we have to remember that they may have been hurt by that student, or something may have happened where that student got a little bit too aggressive, that they weren't feeling safe or comfortable. And we have to take that into account in our training, in our support, and in our suggestions to teachers and parents.
And sometimes this trauma can be, physical, and you can see it. Somebody might actually start crying, but sometimes it's not physical and you can't see it. Sometimes it's, a parent might say, "Oh yeah, yeah, I'll do that," and then not do it because they can't. Or it might be, and you label it as passive aggressive, or you label it as, "Oh, they're just not following through with my suggestions." But that might be trauma. Trauma might be hidden in other ways as well. It might be something that maybe the student is, I don't know, picking his hair or picking his sock, picking his nails. It could be something like that as well that it comes out, or it could be, we just talked about flexibility in another podcast, and it could be, just rigidity, that, they're not able to control one part of their environment. So they're trying to control other parts of their environment, and it's coming out in very rigid or inflexible ways. That could be trauma as well. So looking at that from a different lens is what we need to do as good behavior analysts.
And what does that mean for our sessions or our interventions? The first thing that we want to incorporate is assent. So with anything that we're going to be putting in place, looking for either verbal assent or even nonverbal, like where is this student at? Hanley calls it happy, relaxed, and engaged, where they are feeling good and they're comfortable with what you're doing. There could be nonverbal assent in that way. Or if it's a learner who is verbal and can tell you something that they do or don't want to do, then you can look for assent in a treatment session or within an intervention.
Yeah, really try to, when you're doing things, if you're just starting therapy, or you're putting in place an intervention, or you're just starting some teaching strategy, really put yourself in the learner's shoes and start thinking about that from the lens of the learner. Like, okay, so this learner is starting a new school. What are all the ways that I can desensitize them to this new school? Or how can I make the first day successful? Is there another learner in the school who, may scream in the hallway when new people walk in? How can we, make that better? Maybe we need to talk to this other learner. Maybe we need to bring our student in, earlier or later, or transition them on a different day than the first day of school where it's the busiest. So there's different things that you can think of when implementing new things with a learner who has experienced trauma.
Also, always collaborating with the stakeholders, with caregivers, and with parents in terms of choosing the goals, offering a lot of choice with the learners, even if it's a really young learner, letting them choose which one they want to play with. Hanley also talks about, an open door policy where we don't even close the door. Like they can leave if they want. We're not forcing anything onto our learners. There's a lot of choice and a lot of dignity. A trauma-informed care does not mean that we don't hold boundaries, and it doesn't mean that there are no demands, but it does mean that we are gauging our students' comfort level. And when we are holding boundaries, we're doing it with empathy and with compassion. So it doesn't mean that they don't have to do anything they don't want to do, but we can empathize and validate their feelings. And we know this is hard, and I'm here to help you. And without making them feel extra stressed.
And that's huge, right? Again, something else we've talked about in the past is extinction, and how we don't typically do a lot of extinction anymore because we don't want to necessarily, ignore people's feelings and thoughts. We want to really validate it. So if someone is coming to us and, verbally or non-verbally telling us that they're having a tough time with something, we can validate that. If a student is having a tough time and we're looking at things through a trauma-informed lens, we can say, wow, it really looks like you're having a hard time with that. Or, yeah, you look really anxious right now. Or, hey, how are you feeling? You look this way. And really including that validation, but then still being firm, still being kind, but firm, and saying, but you still have to get through this. Or, what, how about you do one more and then you can take a break? And really still keeping those boundaries in place, but making sure that you are empathizing with them.
And after talking with caregivers and teachers and the individual, understanding which boundaries to choose. Not everything is going to be important to target. And you really should think about, if we're not going to get, everything, what is a boundary that's really important that we can put in place in a kind way? And that's a really important conversation.
So when you're talking about trauma-informed care, trauma-assumed care, I think the biggest things would be looking at that, client dignity piece. And, we've got another video about maintaining client dignity, so you can check that out as well. But it's maintaining client dignity. It's looking at everything from a trauma-informed lens, and not just with a client, but with stakeholders. So those would be parents, caregivers, with teachers, with therapists even may have some type of trauma, but looking at it from a behavior standpoint, looking at it from a setting event, or even from a function of behavior as well.
For more information on trauma-informed care, click the link on or around this video or in the description to claim your free download on applying Universal Protocol. We also encourage you to subscribe to the channel so you don't miss any future videos, and leave a like and comment below if you have further questions.